Hello everyone, welcome to our channel. My name is Zetu. I am a registered nurse. Today I would like us to talk about undescended testes. Undescended testes is a common childhood condition where the boy's testes are not found in the scrotum. It can be one testis that is not in the scrotum, or it can be both testes that are not in the scrotum. What may be the causes? As the child is growing inside the mother's uterus, the testes of that child are formed in the child's abdomen. As the child grows inside the mother's uterus, the testes start moving down. By the time the child is born, the testes will be in the scrotum. It does happen at times that the child is born with the testes that are not in the scrotum. It can be one testis that is not on the scrotum, or it can be both testes that are not in the scrotum. How this condition is diagnosed. The pediatrician will do physical examination when the child is born. Once the pediatrician discovered that the child's testes are not in the scrotum, the parents need to be informed and the parents need to be counseled, because this condition can correct itself. The child can be given a chance from 3 months up to 6 months. You will find that the testes automatically can move even if the child is born. But continuous monitoring by the pediatrician and the parents, so that they can see whether the testes are moving into the scrotum between the period of 3 to 6 months. But if this process is not happening, the pediatrician will refer the child into pediatric surgeon, where they have to do the operation to correct this problem. It is important for the testes to be in the scrotum. The reason is the function of the testes is to produce sperm. For the testes to work well, it needs a cooler temperature, and the cooler temperature is in the scrotum. If the testes are left in the abdomen, maybe in the groin, maybe in the abdomen, the temperature there is higher. Therefore, it can affect the testes, or the testes cannot produce the sperm as it is supposed to, and that can lead into infertility as the child is becoming bigger. What are the operations that can be done by the pediatric surgeon on this child to correct this complication before it causes problems? They can do the procedure that they call orchidopexy. As the pediatrician examines the child as well, they will actually discover that they can palpate, or they can locate where the testis is. Therefore, they will know what type of operation are they going to do. If they can palpate the testis, in most of the cases the testis is in the groin. They will make an incision on the groin where the testis is, and they will free the testis, and they will also make an incision into the scrotum, and they will free the testis right down from the groin into the scrotum, and they will fix it there with sutures in the scrotum. And it also does happen that the testes cannot be found or cannot be palpated. In that case, it means maybe the testis is still in the abdomen. The operation that they will do, the pediatrician, they will do a diagnostic laparoscopy and they will look at the child's abdomen. When they do find the testis in the abdomen, they will free the testis using the laparoscopic instruments, and they will free right down into the scrotum, where they will fix the testis there with the sutures. This operation, sometimes when they are doing laparoscopic, it can be done in 2 stages. It can be a first stage, or it can be finished by doing a second stage. It all depends how far is the testis from abdomen. But both these procedures are successful, and the children, they are actually do very well after the procedure. Therefore, it is important for each and every one of us as health workers to support the parents as well as the children to know the importance that the testes are supposed to be down into the scrotum to avoid complications. And one of the main complication, it can be infertility if this condition is not treated, or if the testis is left into the abdomen, is not corrected, it can also tend to be a tumor, which that is another complication for that particular patient. And as health workers, education and making sure that these little ones, they know what they expect. They must also be taught how to physically examine themselves and keep on checking whether the testis is in the right place, which is the scrotum. For today, we will end up here. If we do like these short videos, please share, please subscribe, and please comment so that we know what we can talk about next time. Thank you for watching for now, and stay safe and stay protected.